my presentation today was around understanding anxiety and depression in the context of MS. So I guess I tried to cover quite a few things. One of them is, I guess, firstly saying that distress sometimes is normal in the context of MS, that it's a particularly challenging condition, and at times, say, for instance, when you've received a diagnosis or when your illness has progressed or you've had quite a serious relapse, then distress for a certain period of time is normal. But then I spoke about the fact that when the distress over time becomes overwhelming, or when it's stopping you engaging in the best quality of life that you can, then that potentially becomes a problem. So we spoke a little bit about that. And then the rest of my presentation was really focusing on the fact that although around a third of people with MS, suffer from significant distress to the point that we would say it's probably clinically significant distress, actually very few people are actually offered treatment specifically for that, or ever even necessarily picked up suffering from that. And that, the real dearth of psychological approaches specifically for MS that is readily available to people. So I spoke about some of the work we've been trying to do in that area as to how do we change this. And that's included partly creating digital versions of our therapies, and creating MS-specific versions of the therapies and so forth. But even then, there's still quite a bit of work before these actually get into the hands of people with MS. So there's a little bit of a way to go. Yeah, so what is distress? I guess not everybody agrees, I should say, first of all. We tend to use it as a kind of composite of feeling anxious, feeling depressed, so feeling a number of potential negative feelings. And we use it particularly in relation to illness-related distress. And the reason we distinguish between that and, say, what we would call anxiety or depression is because anxiety and depression, they can be moods, but those are often used as diagnostic categories in mental health. So there's certain different types of anxiety disorder, there's certainly different types of depressive disorder. And also, I think very importantly, though, sometimes it's much more around the anxiety and depression is related to the fact that you have MS. And that's why we talk about that as illness-related distress. So it's a kind of composite of those types of feelings. It can be normal. So, I don't think I think what we don't want to sort of suggest is that when you have a condition like MS, or indeed any time in life, that, distress is always a problem, because when distressing things happen, then that is a natural reaction to it. So, we don't want to trivialize it either and sort of say, well, you always need to look on the bright side. If you just, the kind of thing that people often say, oh, you'll be right, and so forth. So yes, it is. When you hear bad news, we need to allow people to be distressed and let them sit with that. Sometimes you do have to just experience that, even though it's really unpleasant and nobody particularly wants to experience the distress. But as I mentioned sort of earlier, when it really stops you perhaps enjoying things longer term, or it just feels so overwhelming you can't do things, or that you're constantly feeling anxious to a point that you can't kind of settle those anxious thoughts and so forth, that's when it starts to become problematic. So what kind of strategies can people do when they, both for, I guess, low mood and also the kind of illness-related anxiety? So I guess there's quite a few things. And I think the first thing is look at what are the specific stressors that are causing that problem. So what is, sometimes it might be things outside of the MS. So it's not, we shouldn't just assume it's all to do with the MS, because it might be that you've, somebody's died and it's got nothing to do with your MS, and that's what's causing the distress. So it's important to sort that out at the beginning, but then also to work with the person who is distressed to kind of think, what is it about your MS that you're struggling to deal with? We call these things, were there any critical events? Has your illness suddenly progressed? People sometimes talk to us about the fact that when you have certain changes, like the decision as to when should I start using sticks. As one woman once said to us in some qualitative work we were doing, when does my identity change because of my MS? So these can be quite critical points for people, which we then look at, okay, if that's the critical thing, how do we help you manage that? How do we help you problem solve that? So it's putting in some good strategies. Number one, to acknowledge that this is a difficult thing, but then also to help people kind of unpack that and look at, what's the pros of starting to use the stick? and what happens if you don't use it, and how does one shift one's identity so it doesn't take over who you are. You can still be who you are, but you're now somebody who uses a stick and so forth. So there's some very practical things like that. The other things, like I think when things get overwhelming, people stop taking medication. So if you identify that was a problem, it would be looking at things like how do you help people take their medicines. It's also how do you help people if it's engage in healthy living in the context when you've got a kind of very challenging illness that's very unpredictable and so forth. And a very common thing that we help people with is managing uncertainty, because uncertainty often makes people feel very anxious. And then how do you learn to actually lead a good life while potentially your prognosis and your future is still relatively uncertain? Yeah, so when people are first diagnosed, there's, I guess, potentially a range of emotions. I don't think we should ever assume that everybody's going to sort of experience the same thing. So for some people, it might be complete denial, sort of, I'm my MS is not going to get worse. I'm just going to have a benign form of MS. I'm just going to carry on as normal. I'm not going to let the MS get in the way. Other people might become very angry. I think some of it also depends on the context of the diagnosis. So for some people, they might have had a very sudden flare and be admitted to hospital, maybe not being able to use their limb all of a sudden, and then you get a diagnosis. That's quite a kind of almost quite a traumatic thing for people. And so there's quite a sort of a trauma response where it almost becomes too hard to deal with. For other people, they might have had symptoms for quite a long time. And then actually getting the diagnosis can be a relief, because it's actually, okay, finally somebody's told me what's going on. I remember one particular young woman who'd for a long time had been told that she had a functional neurological condition. And she was trying all sorts of things to get that treated, and things weren't helping. And then when she actually got the diagnosis, it was a relief. It helped her understand and sort of say, okay, now I know what I'm dealing with. So, it really is the whole gamut, from being maybe very distressed, very angry, pretending it's not an issue at all, to actually a sense of relief. I think probably one would be if people become much more withdrawn than they would usually be. So say, for instance, you stop wanting to go to work, or if you are working, or not wanting to go engage in social occasions, the usual sorts of things. And again, obviously people have different personalities, so we've got to be careful we're not sort of seeing that as that's necessarily a problem for somebody. But if somebody usually does those things and feels unable to engage in them, I think also if people are sometimes feeling very irritable, this constant sense that everything sort of kind of triggers, and they're always in that kind of irritable sort of space. That would be another thing. Poor sleep is a real tell. I mean, obviously there are all sorts of reasons in MS why you might sleep poorly, because it might be pain, it might be spasms. But if you kind of waking up and you find it very hard when you wake up to go back to sleep again, that's sometimes a sign of very low mood. And then I think constant rumination, not being able to engage with things because you're constantly thinking about your MS, you're constantly worrying about it, to the point that it's intruding on everything that you do. So it's all about the amount of intrusiveness, I guess, to some point, but also when people are no longer engaging. Yeah. I mean, I guess all sorts of things can, I guess, be encompassed within grief, can't it? And I suppose if you use, people like Elizabeth Kubler-Ross used to have a kind of set sequence that she would describe that people would go through when they were grieving. I think now we know it isn't actually as linear as that, the kind of denial and then moving towards acceptance. And I think for some, the reality is with a condition like MS, you have losses along the way. You might kind of lose your ability to do something that you loved. Sometimes it impacts relationships. We know that there's more breakups in relationships with people with MS, so there are issues like that. You might be grieving the person that you were, or you felt you were. You might have seen yourself as a kind of healthy individual with all this potential, and now you might feel that that's been taken, depending on the type of MS and so forth, taken away from you. So I think there can potentially be all kinds of grief reactions, but I don't think grief is necessarily one thing. But there's certainly it's certainly being able to manage loss and change, and I think people who are able to have what we call a psychological flexibility, who rather than saying, well, if I can't do this, if I say, I'm a marathon runner, and if I can't run my marathons, then there's nothing left in my life. That's then going to be a bigger sort of grief reaction. You say, well, I can't run marathons, but maybe there's other things that I'm interested in that I can now focus my attention on. So there's different ways to responding to situations. Well, it will depend whether you're sort of grieving a loss of something or whether you think, okay, I can't do that, but I can move on and do something else. How important is to talk to others about all the emotions? People, I guess, partly have different styles. Some people find it quite hard to talk, and in which cases we do think it's useful to process your emotions and not try and pretend that they're not there. So for some people, they might sometimes find it easy to write about how they're feeling rather than necessarily talk to others. I think it is important to talk to close people, though, because you can feel very, very isolated and lonely, I think, if nobody really, and also very understood, because if you don't tell people how you're feeling, and with MS, sometimes you can look like there's not much going on. And you might have overwhelming fatigue, but it doesn't look like there's anything. So if you don't talk to people, they're not going to know that. And then that can leave you feeling quite angry, quite misunderstood, and so forth. And we've certainly actually found in some of our studies that actually non-disclosure, not telling people, actually makes people more fatigued. And that might be because, you're holding a lot in when you're not telling people. Having said that, some people have had very negative reactions from people at work. So we can't always say that disclosing you're going to get a positive response. So people do need to be aware that in some cases, we can't guarantee that people are going to respond in the way that you want to. So as long as you know that people might not respond in the way you want, I think it's generally a good thing to be talking about how it's impacted you. So, is there any impact on family and loved ones, and how to manage that? And I think that's such an important question, because MS isn't just about an individual. It does actually affect everybody. Whether if people have children, it affects their children. If you have a partner, if your parents, everybody is going to be affected by the fact you've got this very difficult condition. So I think sometimes people with MS naturally sort of feel, I'm worried about being a burden. I don't want to kind of take too much from people because they're always having to do things. I think what can be sometimes useful then is thinking that, within the context of your MS, what can you still offer them? Because there are things that you can do. So maybe physically you're needing a lot more support than you did before, but you can still be a good listener. And you can still perhaps say to people, I acknowledge that this has changed your life too, and that there now may be a whole lot of other things that you have to do because I'm now really struggling to do that. And it's showing the appreciation for that. And I think also for family members, sometimes family members need to get support too, because some people will almost drain themselves dry being the support person and have nothing left in the tank for themselves. So then it's also looking at how do we help people make sure that even within, if they are in a role where they're caring, and not everybody is caring in that situation, but where they are, how can they make sure that they're getting some of their own needs fulfilled at the same time? Yeah, so are there any sources of help for people who are feeling low? Well, I don't mean to sound negative, but not nearly enough at the moment. And so this is some of the work that we're trying to do, is really bring to the people's awareness that actually there isn't enough to provide this, because it should just be routinely offered. If people need it, it should be there, and actually mostly it isn't. Having said that, I think the charities do a fantastic job of providing wonderful resources, of providing a community for people. There's also patient-led charities like Shift MS, and that was initially really created particularly for younger people with MS, because that was kind of noted to be a kind of gap. So I think there are both with there's the MS Trust, the MS Society, Shift MS, so this is really good. And I think increasingly now, because I think we're recognizing that we haven't always dealt with the fact of the diverse community within MS. There's increasingly smaller groups now like Asian MS, and developing communities for people from particular minoritized groups. So all of these are very important. I think from the point of view of what we offer as healthcare professionals and the National Health Service, I think there's still quite a lot that can be done. People can access, within England anyway, talking therapy services. They won't specialize in MS, but they do specialize in treating anxiety and depression and things like post-traumatic stress disorder. So they can certainly help in those sort of contexts. And people can self-refer, so they don't have to get referred to those services. So there certainly are some resources available, but I would like to see a lot more.